Okay, so I will share my screen here. You guys can go ahead and join me live here on the Hesi. This is the first link in my students announcement page. I'm not sure for Professor Go's class, which if he's provided you this link yet for the Hesi review for next week. Be sure you guys are aware where you need to be when for your Hesi. You have not heard anything, you need to be reaching out to your campuses and your professors, okay? Any questions while I'm waiting for this to load here? Since we didn't take a break, we'll be done for full class time. It's 4:37. Okay. My class likes to get out early versus taking breaks. I don't know how Professor who usually does it, but are you guys good with that from his class?
Yes, I'm good. Well, are you in Central Time or what time are you in?
I'm using Eastern time. So if it was
Eastern?
Central
Okay.
time, if it was Central time, it would be 3:37 p.m.
Yes, ma'am. Thank you.
Full credit. Yep, you're welcome. Okay, let's see if Cahoots will get opened up here for me. Sorry, we're not having the best weather here in Iowa. I'm getting some wind and rain, so I know some of you guys are as well. So my internet's kind of going slow now all of a sudden. So in my course, under the announcements for week 10, you guys should have all multiple Hesi Cahoots links to run through. Also, weeks 1 through 9 are there for each week's Hesi, or excuse me, Kahoot. So you should have access to all of that for studying for your Hesi for next week, as well as your guys' practice exams, your PEDS practice exam on Hesi on Elsevier. Okay, so you'll have another one of those to do as well. Okay. I'll be sharing my screen here in just a second. Okay, since we're doing Hesi review for the um, class, make sure you guys join, okay? Okay, are you guys able to see that now? Yes? Okay. Go ahead and join me on here. Should have about 46 of you. You guys have to run to the restroom or something, it's okay if you have to shut your camera off, but don't be off camera for longer than a few minutes, okay? Oh, somebody's unmuted. Do you guys have a question?
Oh, it's me. Sorry.
No, you're okay. Okay, I need about 26 more of you guys to join me.
Sometimes I cannot even see the question when I'm in code. I don't know why. It's if I see it, it's not giving me enough time to read it, to understand it, and to answer the question. I don't know.
Yeah, sometimes it is pretty quick. Unfortunately, just kind of depends how the connection is. That's why I try to read the question to you guys. So, Sue, I don't see you on camera. I don't know if you ran to the restroom or something.
Oh, I'm here.
Okay,
Thank you.
I see you.
Sorry.
I see you now. Thank you. Alrighty, we'll go ahead and get started here. If you haven't been able to get in yet, you should still be able to get in with the code.
Yeah, I'm working.
Okay. Multiple select. What are the signs and symptoms of pyloric stenosis? Palpable olive-sized mass in the right upper mid-abdomen, projectile vomiting, decreased urine output, spitting up frequently. Okay, remember with pyloric stenosis, you'll have an olive-shaped mass that you can feel in the abdomen, okay? It'll be hard. There'll be projectile vomiting, so different than just spitting up, okay? Spitting up is like they just spit up and they don't get super fussy or upset or angry. Projectile vomiting is they literally would, if you're holding them, they could hit somebody across the room. That's how forceful it is. Okay. And then they're going to have decreased urine output because they're not ingesting the calories that they need. Okay. Good.
Would you tell us on these questions if it's select all or just choose one answer? Because I'm thinking just one answer and just actually select
Yep.
all.
I had said multiple select, but before the question, it showed really quick. So I'm just not sure if it didn't get, you didn't hear me, but yes, I usually do that. Okay. Okay, here's another multiple select. Signs of acute respiratory distress in an infant include coughing, nasal flaring, grunting, or respiratory rate of 52.
You're moving really slow, and your screen was black for a very long time before it showed the question.
Is that happening for all of you guys?
Yeah, the screen just went black.
Yes.
Yes.
A lot of you? Okay.
Yes.
Okay. Well, we'll just see how it works and then I'll talk about the questions afterwards. You guys can hear me now to talk about the questions, correct? Okay. So signs of acute respiratory distress in an infant include both coughing, nasal flaring, grunting, and a respiratory rate of 52. Okay. So fast breathing, nasal flaring and grunting are signs of increased work of breathing.
So it was all of them?
Yep, all four of them. Yep.
Mm.
Retractions would also be one. Okay, another multiple select. While caring for a child, they suddenly stiffen and have a seizure. What should the nurse do? Elevate the head of bed, time the seizure, turn the client to the side, or pad the rails with blankets or pillows.
No, but they look at it, it's not good. Shoot.
Okay, so that one is, did that one work for you guys? Does it seem like it had a lot of responses on that one?
Yeah.
Yeah, that one worked better. Okay. So as soon as a kiddo starts having a seizure, you need to start timing the length of the seizure activity. Okay, that's really important. Turning them on their side so they're not at risk for aspirating. Okay, which is pretty common.
But now elevated, I chose that.
That's okay.
Put it after.
And then padding the side rails with blankets or pillows. So that way they're not injuring themselves. Okay. Okay, we'll go to the next question here. Okay, another multiple select. What may be a problem seen in an infant after open heart surgery? A low heart rate, poor appetite, fatigue, or respiratory distress in the form of congestive heart failure. Okay, so the correct answer, the question was, what may be a problem that you see in an infant after open heart surgery? The correct answers were poor appetite, fatigue, respiratory distress. You don't often see low heart rate. Usually you see tachycardia. Okay. And the respiratory distress is from the heart failure, likely after the surgery. Okay. A young man who has cystic fibrosis wants to have children. How do you respond? Chances are very small that he can have children. No problem to conceive. Males are infertile due to their lack of vas deferens. Would require hormone injections. Okay, so males are infertile. They do not have the vas deferens. Okay, but remember, after they have lung transplant, then it's likely that they can conceive without any problems. Okay, a year after the lung transplant. Okay. An infant with tetralogy of flow has a TET spell. What is the priority action? Increase oxygen to 100%, administer normal saline bolus, place the infant quickly in a knee to chest position, prepare to intubate. Yes, knee to chest, okay? When they're having a TET spell, you'll see toddlers and older kids do this pretty naturally, right? They'll kind of squat down, and then that helps resolve their TET spell. But for infants, parents, or you as the nurse will have to put their knees to their chest to help resolve their TET spell. Okay. And remember, that's when they turn blue and their pulse ox drops. Okay. Okay, another multiple select. The nurse should assess the infant with congenital heart disease for which sign or early sign of heart failure. Fatigues easily, slow and shallow breathing, cough, tachycardia. Early sign of heart failure. Fatigues easily and tachycardia. Slow, shallow breathing and cough, those are later signs, okay?
Did you say that was select all? I don't think I heard that.
Yeah, it was a select all that apply. Yep. So yeah, fatigues easily is an early sign of heart failure and tachycardia also. The other two are late signs. Okay. Nurse provides instructions to the parents regarding administering digoxin. Need for further instructions. So what are they saying that needs further clarification? I will not mix medication with food. I will take my child's pulse before administering the medication. If one dose is missed, I will call the provider. If my child vomits after the medication, I will repeat the dose. Yes. If they vomit, what does that mean? With dig.
Toxicity.
Yes, toxicity.
Thank you.
Yes, Scarlett, I heard you, but I don't see you.
Sorry, I'm like
Now I see you.
So you can repeat the dose if the child is vomited it?
No, you don't want to because they may be toxic on
Oh,
dig. Yeah. Your child has been playing outside in a field with long grass. What would be the priority? Have the child take a shower, look for areas of skin irritation, check the child's head to toe right away for ticks, change clothes. And this was a multi-select. Oh, no, it wasn't. Sorry. I thought it popped up that it was. Yeah, check them for ticks if they've been outside with long grass because of the risk of if they get a tick and it's in place for longer than 36 hours, they're high risk for Lyme disease as well as other tick-borne illnesses. Okay, a toddler presents with sudden severe abdominal pain. The diaper has current jelly, bloody stools. What do you suspect? Hirschsprung's disease, intussusception, intestinal obstruction, appendicitis. Intussusception, okay? Hirschsprung's disease are not those current jelly stools. That's the speckled kind of look to the stools. Okay? But intussusception is like dark red jelly. Okay? Six-month-old infant is placed on thyroid replacements for congenital hypothyroidism. What shows you it has been effective? Unable to lift head, reflex palmar grasp, able to roll over, constipation. Able to roll over because that means that they're meeting their milestones, right? Which means that their thyroid's being regulated enough that they're growing like they should. Okay. Good. Okay. An infant should be able to sit unsupported at what age? 10 months, 9 months, 8 months, 12 months. 8 months. Remembering back clear to exam 1, all of your developmental milestones. Make sure you guys look at those for your Hesi, okay? They like to ask about developmental milestones and theorist, okay? Make sure you guys are looking at that. Okay, multiple select. What assessment would a nurse see with a child who is dehydrated? Prolonged cap refill, decreased urine output, crying with no tears, visible peristalsis. Prolonged cap refill, right? So delayed capillary refill because they're dehydrated. They're not going to be putting out as much urine because they're dehydrated, and they're not going to be crying tears. Okay. Good. Growth hormones are started on a child. What assessment will show that the medication has been effective? Increased hair and nail growth, decreased weight, growth of 2 inches in the past year, increased bone density.
This one to give you
Your screen is black.
Okay, we'll go over it again. Okay, so how do you know growth hormone is effective? The child grows 2 inches in a year. Okay, that's the point of growth hormone, is to help them grow because they have some sort of defect that their growth hormone isn't working like it should. Okay, good. One of the symptoms of rheumatic fever is chorea. What would you tell the parents about these movements? These movements will be permanent. Therapies need to be started ASAP. These movements will eventually disappear with treatment. Antispasmodic medication needs to be started.
No, I just think something.
Yes, so if you treat the rheumatic fever, then the chorea should resolve. Okay. What does rheumatic fever start from? Or what has to happen before you get
Strep.
rheumatic fever? Yep.
Infection.
Strep. Yep. Group A strep specifically. The other types of strep bacteria do not cause rheumatic fever. That's why we only treat group A strep in kids. Okay, a mother of a 2-month-old is worried because the back of the child's head is flat. What should you tell the mother? Place on their abdomen while awake and active. Place a pillow under their head. Turn on sides when sleeping. Have the child sit as much as possible. Yep, good. Place them on their belly. Tummy time. Okay. Good. Making sure to talk to parents about supervision during tummy time too. Okay, good. Okay, what statement from a parent would be concerning regarding a child diagnosed with croup? Cough sounds like she's barking, seems to have problems swallowing, seems to cough more at night. Child has a fever of 101. Yeah, having problems swallowing with croup. Why? What would you be concerned?
Epiglottitis.
Yes, good. Child has myopia. What would be appropriate for the nurse to tell the teacher? Place the child in the front of the room. Give the child big print books. Keep the lights dim. Apply a patch to the unaffected eye. Yep, place them in the front of the room because they can't see from far away. That's what myopia is. Okay. Good. Alrighty, and multiple select. Child is born with myelomeningocele with sensory and motor deficits. Must be careful with what? Aggressive physical therapy, latex allergies, bladder catheterizations, good pulmonary care. Okay, I can see that this is just kind of frozen, it looks like on my side.
Yeah, we can see nothing.
Okay. Okay, so if a child's born with myelomeningocele with sensory and motor deficits, you have to be concerned about them also having latex allergies, okay? And they're going to need bladder caths because they have those motor deficits and sensory deficits, okay? You're not going to do the PT and things like that until after they've had the repair. Okay, what interventions are needed for an immune compromised child that has a platelet count of 10,000? Good hand washing, allow time between activities to prevent exhaustion, strict isolation, bleeding precautions. Bleeding precautions. Is that a normal platelet count?
No.
No, it's really, really, really low. So that means their blood's not going to clot normally, right? Because that's what our platelets do. They help our blood clot. Yes.
Yeah.
So that means we're going to bleed really easily. Okay. So you would want to have them on bleeding precautions. So they're going to be getting minimal blood draws and all of that. Okay, an infant was seen in the emergency room for a febrile seizure. So the mother asks if her baby has epilepsy. What's your response? Your baby will have epilepsy. Most children end up with epilepsy. Many children's seizures will go away as they grow. No more seizures after the first one. Okay, febrile seizures. Usually they have one and then they don't have any more. But about 1 in 4 will have seizures, seizure activity when they have fevers down the road. But it doesn't necessarily mean that they have a seizure disorder, okay? So you can reassure parents that it's unlikely that they will have epilepsy from a febrile seizure. Okay, an 18-year-old parent wants their child's lab results. Do not give out, as this is against hospital policy. Give permission from the 18-year-old, get written permission. You may give the parents the information. Yep, you can get the permission from the child who's, well, I guess the 18-year-old patient. Okay. So they can give you permission to say it's okay to give those lab results to their parents. Okay, what is PALS? What's Synagis? Just so you guys know, this is no longer used. Okay, closes the PDA, RSV vaccine, antibiotic, growth hormone.
Is it good or not? No.
It's an RSV vaccine. Okay. Synagis. This is the one that kids used to have to come once a month. Only high-risk kids could get it. Okay. But we phased this out since we have Nursynimab or Fortis. Okay. But your books and things haven't caught up yet with that change. Okay. So Palcilinimab or Synagis is your option for RSV vaccinations. Okay, what medication can be used to treat an infant that is in the acute phase of RSV? Ribavirin, albuterol, Synagis, Atrovent. Ribavirin, so that's an antiviral medication. So if they're in acute phase of RSV, so usually less than 48 hours is considered acute phase, they can be given ribavirin. Now, I will say I don't see that done very often because most of the time parents have had kiddos at home for a couple days before they bring them in with RSV. Okay. Albuterol is an old recommendation for RSV treatment. So it's not standard like it used to be for kids. Now, of course, if they have reactive airway or asthma and they need albuterol for their reactive airway and asthma symptoms while they have an RSV diagnosis, then you'll see albuterol used, but not very often, especially on kids that don't have like wheezing or reactive airway. Okay, what is the highest priority for a pre-operative infant with bladder exstrophy? Monitor urine output, monitor daily weights, monitor the risk for infection, take abdominal girths. Okay, what's bladder exstrophy?
The bladder's outside the body.
Okay, so what would be your priority before they had
Infection.
surgery? Right, infection risk, right? Because if their bladder is outside their body, their biggest risk would be infection in that situation. What about post-op? What would be your concern? Some infection risk, right? But your highest priority post-op would be their urine output. A smart 8-year-old wants an insulin pump for type 1 diabetes. Not a good option, not available until they're 18. A good option for a 10-year-old, only adults get insulin pumps. Yeah, so usually the number for insulin pumps is age 10. That's what's recommended. Okay. You will see occasionally some providers have some younger kids get insulin pumps, but the recommendation is to wait until they're 10 years of age. Okay. All right. It is now time that you've been here in class long enough. I know you guys just had an exam and you're all overwhelmed. So I will let you guys go. If anyone has any questions, I will be on here just for a bit. Professor Bogart is doing an exam review this weekend for Hesi. I guess it's a Hesi Q&A is what she calls it.